please. And now we're back. Okay, thank you.
Okay, thanks. So we can damage vessels in our hearts and ultimately cause heart disease. For the brain, the same thing happens. Vessels in our brains can be damaged and cause cerebrovascular disease, such as a stroke. So for instance, you can have high glucose and you might think, okay, maybe it's nothing, but then gradually as the blood is going through your vessels, just remember the blood is causing inflammation in your vessels. And this inflammation causes your vessels to develop plaque. So as the plaque develops, the way I explain it to patients is, think of like a road with like nice blood going through it. But then you have this little bump, which is like the plaque. So every time the blood has to go over this plaque, the blood is thinking there's something wrong. And the way our blood defends itself, it clots. So gradually as the plaque gets bigger, you're going to be prone to developing clots, which can make you develop a stroke. For the peripheral vascular disease, this is damaging vessels in your arms or your legs. It mostly happens in the legs, where the vessels are damaged, so the blood flow is affected. And this is how people with diabetes, and they end up developing like ulcers or sores, because blood flow is not able to get to their legs properly, and they end up with sores or ulcers. For microvascular disease, increased blood sugar can also cause retinopathy, because it damages the retina, and it damages blood vessels in the eyes and affects the retina. So patients start having trouble with seeing properly. There's like fluids building up in the eyes because the vessels are damaged and the blood flow is affected. For nephropathy, which is a small vessel damage as well, nephropathy comes from nephrons. So nephrons are like the tubes in your kidneys that allows fluids to flow back and forth and helps you to get rid of toxins and to keep your kidneys working well. So when those nephrons are damaged, your kidneys don't work well and you end up with nephropathy. So neuropathy is when nerves in your legs or arms are damaged. These are nerves that send signals to your body. So people with neuropathy would suffer from things like needles. They're feeling like needles and sharp pain in their fingers or toes. And ultimately, what happens, someone with neuropathy, they cannot feel well. So this is why someone with diabetes, after not being able to feel well, maybe they'll have like a little sore or a small scratch or something on their toes, but without realizing it, it can be getting bigger. It can turn into a huge sore and then can lead to amputation. So I do have another slide on that as well. Thanks. So what are these complications? So complications from diabetes, this is what I just went over in that diagram. They develop over time. If your blood sugar is not, of course, controlled, it increases the risk of these complications. So you have vessel disease leading to heart attacks or stroke, eye problems causing retinopathy, infection or skin conditions, nerve damage, which can lead to neuropathy, kidney damage, leads to nephropathy, and amputations, like I was just saying, due to neuropathy or vessel disease. One of the things that I think many people don't realize is that diabetes can actually create a form of Alzheimer's. So I recently had an experience where my godmother called and she was like, oh, I'm forgetting everything, I can't remember anything. And I couldn't understand how all of a sudden she's having memory issues. So then I took her history and everything and I realized that it can be Alzheimer's disease from her chronic diabetes, because she never takes care of herself. And the doctor is always on top of her, like you have to, be better with managing your blood glucose. So the nerves in your brain, they're damaged. And after a while, there's plaque as well in your brain, and it causes Alzheimer's. So this is something that I think maybe people can be educated better on, because
Is that something that just recently has been developing Alzheimer's? Is that something recent in the medical field dealing with diabetes?
so this is actually not new, but because it takes so long to happen, some of the other things happen quicker.
Yes.
So you'll see your doctor for them, but because this one is taking so long to occur, you'll find that by then you might be older and people just assume you're having a basic regular Alzheimer's when it can be linked to your diabetes. So one way that, that's a good question, by the way, thank you. One way that you can try to see the difference is when someone starts having memory issues, they should have a thorough neurological exam, and they should also have a brain scan. Because when the brain scan is done, you can actually see like what's happening. If there's real plaque, maybe you'll see the vessels that are damaged, so you'll see what's really causing the Alzheimer's.
That's from the scarring on the brain.
Exactly, because Alzheimer's has specific things. Like Lewy bodies, and it's like specific things that you look for with Alzheimer's. So it'll be different from what you will see with someone with diabetes. So, and what happened with my godmother that was frustrating is that the doctor actually did nothing and started giving her medications for Alzheimer's without doing anything. So I found that to be frustrating. Thank you.
Thank you.
So the focus of this talk today is to focus on tips that we can use to enhance our well-being when we have diabetes. So some of the things I listed: monitor and manage your hemoglobin A1C every 3 to 4 months, which I explained why before. You check your blood pressure, cholesterol, and urine every time you visit your doctor for your diabetes. Some doctors are good with this. I find some primary care doctors, they're seeing so many patients, they're like in a rush to do things. So they're not, even if they're checking these things, they may not even call you back or say, oh, this is, this is a little elevated or whatever. The reason why, so sometimes you have to remind your doctor. And a lot of times I tell patients, you can have your primary care doctor, but for your diabetes, if it's not being controlled, you need an endocrinologist, because that's the person who's going to focus on controlling your diabetes. So the reason why blood pressure, cholesterol, and urine are important: blood pressure, if your blood pressure is not being managed, this as well is going to damage your nephrons in the kidneys. And on top of the sugar, you're going to have kidney failure at a young age. So it's important to have blood pressure managed. Cholesterol has, increased lipids, causes plaque in the arteries as well. So that as well, on top of the diabetes, can cause vessel damage. Your urine should be checked for proteins, because proteins in the urine at a certain level tells you that your kidneys are being affected. And this way the doctor can put you on. Most of the times patients with diabetes end up having to be on medication for blood pressure, because a lot of times your nephrons are already damaged a little. So then the kidneys can't work as well. So for it to regulate, then you need sometimes blood pressure medication to help it regulate, which is better than the kidneys failing. Because I always say to most patients that ask, kidneys I find are like one of the most important organs, because things are filtered through your kidneys, and the kidney is the organ that's perfusing every other organ. So if your kidneys don't work well, and I see this all the time with patients in the hospital, your kidneys don't work well, you get very sick, because nothing is being perfused well, your heart, your legs. So it's a big deal, protecting the kidneys. So you manage your eye care by getting annual checkups, manage your dental care, you take care of your skin, feet, and toes, and you should also keep your immunizations up to date. So this slide is saying manage your hemoglobin A1C levels, and it's getting a bit more into detail. So for that, how do you manage your hemoglobin A1C levels? You check your blood glucose every day. It might seem like a chore, but this is the only way you can see what the levels are. If you're waking up in the morning and it's like very high, then this is of course linked to your diet. Maybe you say, oh wow, what did I eat yesterday? Because you're checking it daily and you can make adjustments. So, and you should have a book to document this because people usually forget. Check also your hemoglobin A1C should be checked every 3 to 6 months by a doctor. You should manage your medications. Managing your medications, this is where you look to see, sometimes they start off patients with 500 milligrams of metformin. And you're taking it, but you're seeing your blood glucose levels are still elevated when you get up in the morning. Then you should go to your doctor and say, hey, I find my blood sugar is still high. So the doctor know most people on metformin would take morning and night metformin. But in the beginning, they start you, that like we call it titrated upwards. So they increase the dosage as you go along. So you have to be vigilant to let your doctor know, because by the time he's checking your hemoglobin A1C to see that your glucose was out of control, you know, there could be other things happening. Manage your diet, make sure what you're eating, you keep track of it because there's specific things that trigger some people to have high glucose levels. So keeping track of your diet is important. Exercise 20 to 30 minutes daily. This I think is so important because I don't think everyone sometimes relates. We know exercise is good, but what is happening here? When you're exercising for 20 to 30 minutes daily, the sugar that's sitting around in your bloodstream actually is able to be utilized by your body, by your muscles. So it gets into your cells. Then your blood sugar level is going to be lower. So I actually tried this with my mom because she would get up in the mornings and her blood sugar would be high. And I said, Mommy, can you exercise 20 minutes every day? She would walk in her hallway because it's a long hallway. So she walks back and forth for 20 minutes every day. And she would be so amazed. Oh, wow, my blood sugar, it literally went down. So it was very effective. And this is why it should be a daily thing, because someone with diabetes, you need to have daily exercise, because this is the only way the sugar is going to get into your cells. Yes, thank you. So this is eye care management. So I wish they can see this picture better because
Let me, I
it
can.
shows you. Yeah,
There we go.
okay, that's good. Thank you. So someone with diabetes should see the doctor at least once annually. Chronic diabetes, like I said earlier, damages blood vessels in the eyes, and this damage can cause symptoms such as blurry vision, black spots and floaters in the field of vision, like you look and some people start seeing as if something is floating in their eyes. Retinal swelling, which is macular edema, so there's fluids building up in your eyes because the vessels are damaged and things kind of go in and out like they should. Poor color perception and blindness. So the reason why this is important, because as we get older, people sometimes think they attribute things to the fact that someone is getting older, which is so annoying because I'm not that old, but it is frustrating because I take care of my mom for a lot of things. And when she comes and says, the doctor says this, and I speak to them on the phone and they realize I know more, so they can't say that with me. I'm like, what are they saying, proper things to her? So if you look at the picture, the normal eye, you can see the vessels are clearly defined. However, in the eye with retinopathy, you can see even like a little bit of bleeding because the vessels are damaged and then they bleed and then it creates inflammation, because anything that shouldn't be there, the body responds by bringing, like prostaglandins and all those things that fight inflammation to that area. And that's why it looks that way. So this is where we want to protect our eyes, because if you don't go to the doctor for a whole year, by the time you get to the doctor, you might be like, oh, I'm getting a little older, I don't see too well. But by the time you get there, your eyes might be damaged, and this can actually cause blindness. So it's actually very important. Any questions from anyone? Roberta looks diligent.
I put one in the chat. Can you see it?
What did you say?
Oh, she put a
Put
question.
one in the chat before.
No, I did not. Let's, oh, there we go. When there is damage, can it be rectified by better diet, or is it too late to correct?
So that's a great question, Roberta. The damage for what exactly are you asking? This for this specific case?
Well, you were pointing out that diabetes can cause all kinds of problems to different parts of the body. Once it's affected a part of the body, is it too late to rectify it, or is that damage done? It's a done deal.
Most of the times it's a done deal in the sense of, okay, for your kidneys, for instance, if your kidneys are damaged, those nephrons are damaged, but you can like slow the damage is what the care is supposed to do, like slow that damage so the side effects, are not, they don't come on as fast as, as they would if nothing is done. For the eyes, for instance, if you check with your doctor, if by the time you get to your doctor, if you already have vessels that are damaged, those vessels can't really be repaired, but when the doctor treats you for retinopathy, the inflammation is going to go away, the swelling is going to go away, and you see better. So your vision will get better. However, if nothing is done, that's when it becomes like a done deal.
That's
So-
what causes glaucoma and cataracts. It can lead on to that.
Glaucoma is a different pathophysiology.
Okay.
It has to do with more of like blood pressure. So glaucoma has to do with when your blood pressure is too high.
All right.
It causes like, you call it hypertension in the eyes, and it damages the optical, it's different.
Different, it's totally different.
Yeah. So did I answer your question, Roberta?
Yes, I know that diabetes runs in my family. I'm fortunate not to have it at this point, and I'm listening to you, so I know what to do to prevent it.
Oh, well, thank you.
Thank you.
You're welcome. The next. So for dental care, you should visit your dentist every 6 months, brush and floss daily, limit simple sugars in the diet, because diabetes has an increased risk for developing, people with diabetes, has an increased risk for developing gingivitis, gum disease, thrush, and dry mouth. This happens because people with diabetes, when there's a lot of sugar, our bodies tend to want to, how do you bring the sugar down? So I'm trying to think of a good way to explain this. So this has to do with like osmosis. When there's a lot of sugar, the body has to use all of the water that it has in it to like, almost like bring down that sugar. So your cells are like dried out basically, because your cells are trying to just get whatever water you have in your body. So other places suffer. Your mouth is going to be dry, which is why they have dry mouth. When your mouth is dry, you're prone to having a lot more bacteria, because we need the saliva or not wateriness in our mouth to get rid of bacteria. So this is why you have dry mouth. Then you can develop thrush and yeast infections easily. Of course, if your mouth is too dry with the sugar and not enough saliva, you get gum disease, gingivitis. Then you have periodontal disease. So in this last bullet I have there, recent data analysis has shown that the prevalence of gum disease in diabetic patients was 86.8%, which is very high. And if you look at the numbers, periodontitis was actually higher than gingivitis, which means by the time people get to the doctor, they already have advanced gum disease. Gingivitis is like mild gum disease. Periodontitis is when disease is so deep in your gum, then you can lose gum, what is it they call it? Yeah, like you lose bone and all that from your, so then you can lose your teeth, you won't have any teeth. So the picture that I have in the bottom is just someone with diabetes, they present this way because a regular person like come in, they have 1 or 2 cavities. Someone with diabetes, there's so much sugar in their blood that they have like 4 and 5 cavities all at once. And then you're like, something is.
Could you explain, please, what thrush is?
Thrush is fungus.
Oh,
It's on the tongue.
yeah.
So it usually looks like whitish, but
Okay.
if thrush is really bad, it actually kind of almost eats on your tongue and makes it burn when you're eating food. So and that's because your mouth is so dry and bacteria is just sitting there. So you develop, yeah.
Thank you.
You're welcome.
Ready?
Yes. Oh, I think Roberta has a question.
Yep.
Okay, I just actually have a comment. I tend to be good in medical follow-ups and going to the doctor and dentist regularly. My dentist just recently said that in addition to what you're saying, a lot of people have been developing dry mouth and therefore gum disease and so forth. Not because they're not taking care, but because they're wearing their masks so much. That's a factor because it's preventing the moisture.
That is so true. And then we're drinking less because sometimes you have on your mask and you're not drinking.
Yes.
So that's such a good point, Roberta. Thank you for sharing. So this slide is about taking care of your skin. When someone has diabetes, they should try to prevent dry skin. Keep their skin should be kept moist. So in the winter, it's good to use a humidifier because we know the heat dries out our skins. Avoid hot baths and showers. Use moisturizing soaps like oil of Olay. Bubble baths you sit in them for a long time, they feel good, but they're drying your skin out. So, and then it's usually like hot water. So moisturize your skin, but not in between the toes. Reason being, this is mentioned as well in another slide. In between the toes, people with diabetes are prone to developing fungus because if it's wet in between your toes, you really want to dry that out. So not in between the toes. Manage your glucose levels, of course, because something that happens with diabetics, I don't know if you guys have ever seen this, but sometimes you may not know the person has diabetes, but sometimes you may know, and they have like a dry, ashy kind of skin. That's like urea, which is one of the waste products that comes out of your kidneys. It shows up on your skin, and that's when your kidneys are damaged, where the end products that should come out of your body is coming out through their skin, and then their skin is like really dry and ashy. So this is how, sometimes they're not managing their glucose levels. See your dermatologist as well. There's an ulcer. We can't see every part of our bodies, but the dermatologist should be looking from your head to your toe. So if there's something, they should see it or find it. Yes, next slide.
What did I do? That wasn't very clever. All right. There we go.
Thank you.
Mhm.
So this one is about your toes and feet. So to prevent ulcers or infections, Roberta's looking at that. I hope she can see the picture.
Yeah, she can.
Yeah, wash your feet thoroughly and daily. Dry your feet in between toes well. Moisturize feet, but avoid moisturizing in between the toes. Inspect feet for sores, cuts, and bruises. This is very important because someone with diabetes, because of neuropathy, may not feel anything. So you have to look, because only when you look, this one is an indication of someone, and this is a big problem. This is why there's footwear for people with diabetes. If you wear a shoe, a regular person can wear a shoe and it may cause like bruising, like this person here developed an ulcer. However, with diabetes, you'll develop that, but it will take longer to heal. And let's say someone develops that and never looks or pays attention. This ends up becoming from cellulitis, then it becomes osteomyelitis, which means the cells are inflamed. Then it becomes bone. A bone infection, it actually needs IV antibiotics. Then, of course, if it's never treated, which is why they have amputations, because if someone has osteomyelitis, in order for the infection not to spread, then they'll amputate your toe, if it's that bad. So you really want to pay attention and look. The next one says check your shoes for any sharp objects such as small rocks or pebbles that may be inside, so you don't step on something and not be aware. Wear shoes that fit well and do not rub on your toes or feet, and see a podiatrist every 6 months or as needed. The podiatrist should be seen as well for cutting your nails, because when you have diabetes, you want to try to prevent any cuts or anything that will not heal as well. So especially on the toes where the blood flow is already, might be compromised. So this is someone with a foot ulcer. And in the bottom, we can see it's black over there. That's another ulcer. The one that's black, it's necrosis. So that's like dead tissue. The only way you get rid of that is by what they call debridement. You have to cut that out. You want to cut it to the point where it's bleeding, because it has to bleed where blood can get to it so it can heal. So, this can look simple there, but when the doctor is going to cut, they might realize that actually really has gone into the bone. And then it becomes a case where they're like, oops, we have to cut off half of your foot or something, so it's really serious. The toes over there, that's like fungus. And if you see the little white thing, that's like the dry skin I was talking about, which is why you want to keep it moist, because dry skin tends to cut and bruise easily. So, yes. Any questions?
I have a question about moisturizing between the toes. Oh, somebody else is speaking, sorry.
No, that's you.
It was me?
It's you.
Roberta's like, that's my voice. I know that feeling.
I was hearing myself, I guess. When a person is a diabetic, they should not moisturize between the toes. What about if you're not a diabetic? Is that a good idea, and especially in the cold weather?
It's, you know what, this is very interesting because I met an orthopedic doctor once who said to me, well, I moisturize my toes because I had to say to her, I said, I'm a Black person. So there's a difference I find sometimes, ethnically or racially, because a Black person, most Black people know if we don't moisturize our feet, they look ashy. Right? So, it's very tricky. Whereas someone who is lighter in complexion, if they don't moisturize their feet, you may not even notice. So I would say if your foot is dry and you need to moisturize it, you should. However, you shouldn't overly moisturize it. And someone with diabetes, a regular person would have an issue, but someone with diabetes, the moisture stays there. And that's what can cause breakdown. So there's a reason why you're not leaving that moisture in between your toes, because you already have toes that do not have enough blood supply to, kind of defend them. So yes, I would say not to moisturize. Even if you moisturize it, maybe dry them off. So it's like a little moisturized, but dried off. One of the things they recommend using would be like petroleum jelly, because you can put some of it, but it's not like a lotion where it's like all, like gooey, whereas the petroleum jelly can just like take away some of the dryness, but not overly. So, and then that kind of dries into your skin. So, did I answer your question?
Perfect.
Okay,
Thank you.
Let's say something.
Yes.
I think you can, especially with me, when, I take a shower, I moisturize around my foot. One thing I don't go between my toes, because I don't, it sweats, and by moisturizing it, I don't, that will grow bacteria. So I never do, but around, like you said, with dark skin people, if you don't to moisturize, it looks really bad. So
Mhm.
I do moisturize my, my foot, but not between my toes. Yeah,
Yeah, that's a good idea.
yeah.
Thanks, Rebecca, for sharing. Yes,
Okay.
thank you.
Mhm.
So this last slide is, I think it's almost the last slide. It's saying to make sure your immunizations are up to date. So someone with diabetes should get an annual flu vaccine. It's recommended by the CDC, and a pneumonia vaccine even before 65. So I have a little picture there. It says age 65 or older. That's like the recommended age for the pneumonia vaccine. But if you have diabetes, the doctors would advise you to get it sooner, because the reason why it's not that someone with diabetes gets the flu or pneumonia more than other people. It's just that their immune systems are compromised. So it's something like someone with cancer, for instance. You'll tell them to get it because if they were to get sick, they're going to take longer to recuperate, or they may get sicker than other people. So this is why this recommendation is there. Next slide. Thank you. So I have a question, a little quiz with 2 questions. Which lab value should you have monitored every 90 to 120 days or every 3 to 4 months by your doctor for optimal diabetes management? Cholesterol, red blood cells, hemoglobin A1C, or glucose?
See,
It's all of them, right?
Okay.
I think
Lonnie?
it's all of the above.
The question says every 90 to 120 days or 3 to 4 months. That's the key.
90 is 3 to 4 months.
Either. I just put 3.
Cholesterol, sure. Probably cholesterol.
Any responses, Roberta? Which lab value should we have monitored every 3 to 4 months for optimal diabetes management?
Whichever one is the sugar, which one is the sugar, the glucose?
Glucose, that's it.
And what is the hemoglobin one mean?
Hemoglobin A1C is the one that I talked about in like one of the first slides that I said, are you able to go back to that slide quickly or no? Because I feel like this is something. The answer is hemoglobin A1C. So I'm just going to reiterate
Here we go. There we go.
that, because it is important that you understand that the glucose is what you monitor daily. So you go to the doctor, he doesn't want to see your glucose because he's going to take hemoglobin A1C and see how you've been eating for the last 3 to 4 months.
Right.
Oh, there we go. Oh, there you go.
So he's able to say to you, hey, you can't trick me. You have not been eating well because your hemoglobin A1C, let me see if I can explain it a little better so you guys can remember. So hemoglobin, you have hemoglobin, different types of hemoglobin. You have hemoglobin A, hemoglobin D, and hemoglobin C. Then in hemoglobin A, there's a subtype of a C, of a 1C. That subtype is specific to glucose. So when you're eating, the glucose attaches to your red blood cells and sticks to it. And it stays there. And since the red blood cells, their lifespan is 90 to 120 days, it means that hemoglobin A1C is going to be stuck to it all the time, staying with it. So when the doctor checks your hemoglobin A1C, the doctor can now see that, hey, I see how much glucose you've been eating because your red blood cells, it's attached for the last 3 to 4 months. So, it actually, there is a video that's really going to explain a little better. So
That's the one that you can't hide what you've been doing.
Yeah.
exactly. And that's the one should be checked every 3 to 4 months.
It actually reminds me when I was pregnant, I never gained so much weight, but a friend of mine did. And 2 days before she'd go to the doctor, she'd go on this drastic diet thinking she could fool the doctor. But you're only fooling yourself if you do it.
Exactly. You're almost there. Okay, go ahead.
There we go.
So the second question, diabetics should see all of the following doctors at least once a year, except the eye doctor, dentist, the foot doctor, podiatrist, or the orthopedic doctor. which one of those doctors do they not have to see?
The orthopedic maybe?
Once a year.
Okay, Roberta, you got your answer, Rebecca? Which one?
Oh,
Should you see the eye doctor at least once a year?
yes.
The dentist,
Yes.
the foot doctor?
Yes.
What about the orthopedic doctor?
No.
No. I don't
That's the
think so,
answer.
no.
You got it. Process of elimination. The
Okay.
orthopedic doctor, of course, if something's wrong with your
Yeah,
bones,
yeah.
your pain,
Yeah.
but all the other three should be seen at least once a year. Thank you. Next slide. So this is a little video. It's like 8 minutes. So we'll just show it quickly. It's working, yes.
And hold
It's
on.
going to give a
I
big,
can't let diabetes get in the way.
big Jonah.
Can you hear it, Roberta?
Big Jones.
Oh, I heard garble.
Okay, let me hold on a
Supposed to do that
second.
every day, gargle.
Just give me a second to fix
But the fellow didn't
this.
tell you that. Dr. Ackerson.
Robert, you're funny.
Great. It's, I know. Oh, share screen, hold on, share sound, there we go. I knew there was something I was missing.
Come on, you're so good with this.
I'm the best, let's face it.
You are.
Let's just be
I'm gonna
honest.
make you my permanent.
There we go.
Here's what I do. I wear this Dexcom G6. It continues.
That is very loud, let me,
The Home Health Quality Improvement National Campaign welcomes you to a short educational program called Diabetes Self-Care. In this program, we will discuss some tips and tools to help you manage your diabetes better. There are many self-management tools. Some of the more important ones include hemoglobin A1C, foot care, eye exams, blood pressure, cholesterol or lipid levels.
I can't hear anything.
Consider the fats in your blood.
can't hear, okay, let's see if I can,
Hemoglobin A1C is an important tool that doctors and your health.
is that better, Roberta?
No.
Okay, let me see if there's, okay. Hold on. I thought I had this.
Can you hear it there?
Yeah, yes, it's very loud.
No.
Optimize for video clip. All right, let's try
Share
this.
sound. You did say share sound.
I did. So let's see if that's, okay, let's see it. Tell me if this is better.
Leave it in that small screen.
Healthcare team will use to determine if you are pre-diabetic or have type 2 diabetes. The A1C, as we will call it,
No.
is actually a 3-month look back in history of your everyday blood sugars.
No, that wasn't better?
Not at all.
All right, so what do you
We
want?
could just watch it quickly and then.
Why don't you just show it for everybody there and I'll just watch and see what it says or does.
Okay, we have a recording, so you'll see it.
Thank you.
When your doctor requests blood work that includes an A1C, there are people in the lab that actually count the number of sugar molecules on each of your red blood cells. As you can see, the higher your A1C, the more sugar molecules there are on your red blood cell. If you would like to have a quick look and an easy way to keep better track of your A1C and blood sugars, then take a look at this chart. This chart can serve as a reference to you and help you follow your A1C levels more closely. For example, on the left side of the chart, locate the blood glucose of 140. It has the red circle around it. Now look on the right side of the chart, locate the corresponding A1C number. What do you see? The A1C level is 6.5. So if you are averaging around 140 blood glucose levels, you would expect your A1C level at 6.5. If you see an increase in your blood glucose levels, then there will be an increase in your A1C level as well. The next topic of discussion is care. With diabetes, there can be a decrease in blood flow to the feet, so it is very important to take care of them. Examine your feet every day by looking at them. If you cannot bend over, use a mirror. Place the mirror on the floor and place your foot over it, moving your feet around until you have looked at your entire foot. your toes because it may become too moist and cause sores to form. After bathing, use a pumice stone to remove the dead skin from your feet and to avoid the cracking on your heels. Only use the pumice stone in one direction so you're not rubbing the skin. If your toenails are soft, you can cut them using a straight-edged nail clipper. Do not use a nail clipper that is curved. If you need to file your nails, file straight across, but not in a sawing motion. If your nails are hard, it is best to see a podiatrist or have your doctor cut them. If possible, you should wear white cotton socks to absorb moisture. Always look to see if there is any drainage from your sores that have appeared. And lastly, do not go barefoot to prevent any injury on your feet. Ask your healthcare provider for a handout on caring for your feet. Also learn how to pick the right shoes so they don't rub and cause sores to open up. As a person with diabetes, it is also important to care for your eyes. A yearly dilated eye exam is necessary to prevent diabetic retinopathy, which is a disease of the retina. Diabetic retinopathy is when there is damage to the tiny blood vessels in the back of the eye. These tiny blood vessels in the retina will bleed and cause damage to the retina. If it is left untreated, it may cause blindness. Laser surgery will help prevent the blood vessels from bleeding and reduce some of the damage that has occurred. Diabetes also puts you at risk for developing cataracts, which is a clouding of the lens which affects vision. Diabetes also increases your risk for developing glaucoma, which is elevated pressure inside of your eye. This is similar to a sink that is clogged. Caring for your eyes when you have diabetes is something that everyone must do to prevent these complications from occurring. It is also very important to make sure your blood pressure is under control when you have diabetes. The recommendation for blood pressure for people with diabetes is 130/80. When talking about blood pressure, the top number refers to the amount of pressure on your arteries when the heart is pumping. This is called systolic pressure. The bottom number refers to your blood pressure when your heart muscle is resting between beats. This is called diastolic pressure. Controlling your blood pressure will help to prevent further complications. The last thing for self-care management we will discuss is knowing what your cholesterol and triglyceride levels are and if the levels are good or bad. Too much cholesterol in your body can form plaque, which will adhere to the walls of the arteries, causing them to narrow and gradually become blocked, potentially leading to heart attack and stroke. Triglycerides are the major form of fat stored in the body. Cholesterol in your body has two sources: diet and what your body produces. A diet high in saturated fats will increase your cholesterol levels. But if you eat a diet low in saturated fats, it will help decrease your cholesterol levels and reduce your risk of heart attack or stroke. Your body will also create cholesterol as well. It is important to get your lab work done as ordered. So here is an easy way to remember your numbers. Cholesterol should be less than 200. Triglycerides should be less than 150. LDL, or lousy cholesterol, should be less than 100. HDL, or happy cholesterol, should be greater than 50 for women and greater than 40 for men. So if you subtract each value by 50, it becomes an easy way to know your lipid numbers. The more you know about your health, the better you'll be able to prevent complications. Here are some key things to remember. Be sure to
The bad cholesterol is which one?
The bad one is LDL. And that should be
LDL.
low. Mhm.
And that has to stay low,
Mhm.
lower than 150,
Yes, it should be lower than 100.
lower than 100.
Yeah.
I'm just gonna stop share for a second, and we're gonna go back to the screen,
Yeah, go
right?
back to that again,
Thank
those
you.
numbers.
Okay.
Huh?
What to eat is what is important.
Exactly. Thanks, Lottie.
Yes.
Why am Oh,
Oh, and
cancel, we're not canceling.
So you're going back to the Zoom.
Oh, yeah.
Cancel that.
Yeah, no, but-
Oh, that's what you want.
That's what I'm trying to do.
So just minimize from this.
Yes, I'm gonna do,
Oh,
and why am I
yeah.
not seeing?
Where is
I'm
it?
gonna get rid of.
I believe in eating.
It's what you eat.
Also
Yeah.
stress, too much sugar, you know.
Well, you don't want too much sugar or
Yes.
What?
Like too
Oh,
much
I hate
cholesterol.
this.
I know.
bad cholesterol
Okay.
and fats.
Maybe you want to
Where's the-
more?
And I think vegetable
Hold on, where am I?
have to watch.
Roberta,
tomatoes,
you still
have
there?
garlic milk, tomato.
Okay, you found the slide.
I think
I
I
am
love.
here.
Oh, okay.
She's in this.
Here, I just need to get rid of, where's the, oh, here, I'm gonna get rid of this. And,
I think that's it, but you're sharing what we have to see.
yeah, I'm sharing, well,
But she can
you can
hear
see us, so it doesn't matter.
Yeah, so cancel. No, end the meeting.
Cancel. Okay, there we
All
go.
right, so basically the presentation is finished.
Okay.
And I'm looking to see if anyone has any additional questions.
Here, I'm just gonna stop share so we can see
Oh, that's
everybody.
it. You did it.
I can do it. I
Roberta's
did it.
smiling sweetly.
Petronella?
Barbara can do anything.
Given enough
What
time.
was the
Now,
number?
Barbara, you're the doctor, not just for plants, but for us too.
That's it, yeah.
Yeah, so Robert has a question.
That's the one with the 40?
So 40 is what the HDL should be for
Right.
men.
Less or more than 40?
It should be more than, for men, it's 50 and women more than
Okay.
40, greater than
No, it's
40.
the other way around, I thought.
Women, it's usually lower number, and for men, it's higher. That's what I'm remembering, but
Okay.
unless I'm
That's funny.
forgetting,
Okay.
yeah.
And the LDL is less
The
than 100?
HDL should be,
Less than 100?
yes, less than 100. HDL should be as high as possible, but usually it's like 60 for a good HDL. Yeah. Women should be greater than 40, men greater than 50. I could be wrong.
Thank you so much.
Well, thank you
I
for
still believe.
coming and
in
attending.
eating The way we eat, because
That is,
in America for many, many years, people didn't actually
Greater than
eat what
40.
would be healthy.
Yeah.
Too much sugar, too much meat, you know,
Too much red meat, and that's what we were raised on.
red meat, yes.
Yeah.
That's why it's good we're gonna have something new for lunch. 2 vegetarian meals a week.
Well,
Yeah.
that's good.
I
I grew
know.
up in Germany.
That's a good thing.
Mhm.
I told Andrew, that's a good thing.
It is a good thing. I think more people want to eat vegetarian.
Sure.
anyway.
And we still get the protein, it's vegetable protein,
Mhm,
so.
Yeah, exactly.
So if no one has any other questions, I'd like to thank you for your time.
That's why you're skinny like me.
Roberta, yes,
Yes,
question, go
Roberta.
ahead.
It's more a comment, when we eat, we might say we should eat more fruits and vegetables and whole grains and so forth. And yet when we eat, if we have an apple, which is natural, but it's still high in sugar, they say to have something like peanut butter or nut butter with it. So it'll slow down the amount of sugar being absorbed into the bloodstream. It does it over more of a period of time then. So even how we eat should be something that we should be addressing.
I agree, because the reason for that, Roberta, is because when we're eating, it should be, the way food is metabolized is when you have some fats, protein, and carbohydrates combined. It's
Right.
not when you eat them separately. So that's exactly why that's recommended. Yes. Thank
I've
you.
actually, because of this pandemic, I've gone on to a lot of nutrition classes and cooking classes. And over and over the period of time, not only do I buy and cook differently, but my mindset is different. I no longer even think, oh, what should I make for supper? Should I make chicken? Should I make fish? Instead, I do the other way and I say, what vegetables and grains do I have? What am I going to throw in with it? That's the other kind of protein. And so it's a whole different mindset. And I think I'm eating better because of it.
Great point. Thank you. Thank you for the other person on the line.
Thank you so very much for being here for us.
Of course, you're welcome. All right, goodbye. I know Barbara
All right,
has a meeting.
Thank you very much, Roberta. I'll see you
Thank you.
soon.
Okay,
Thank you.
Very helpful. Bye-bye.
bye-bye now.
You're welcome.